Hi, guys. This is Dr. Tony Hampton, family and obesity medicine doctor here today. And it's not quite the same time where my guest is. She's in the UK, and I'll introduce her. But I really want to welcome you guys to our post-podcast, episode 15. And today I'm joined with Dr. Jen Unwin, and she's a consultant clinical health psychologist based in the United Kingdom. And where I'm at, it's about 8:45 in the morning. And what time is it for you, Jen?
2:45 in the afternoon.
Absolutely. So 6 hours difference. But she's agreed to spend a little time with us this morning after our podcast. And she's a NHS. She's helped people manage chronic illnesses to help people achieve their well-being with the NHS, and she's worked with a well-known family doctor in the UK, Dr. David Unwin, who is known in the low-carb community and helps patients as well work on lifestyle changes. As you know, that's my big thing. She's also a fellow with the British Psychological Society and a former chair of the UK Association for Solution-Focused Practice. So I really welcome her to our post-podcast show. And during the podcast, we talked a lot about the struggles that people have dealing with chronic disease. And we talked about how hope is important in restoring people's ability to do well, to manage those diseases, and hopefully reverse them. And we also talked about her acronym called GRIN, which I love, GRIN. And we talked about how that's important to help clinicians and patients do what they need to do to achieve the optimal health they're looking for. That episode of the podcast will be out October 9th. And so I encourage everybody listening to check that out. You can go to my website, drtonyhampton.com, or you can get that on your favorite podcast app. But during this session, myself and Dr. Unwin, we're going to spend some time talking about sugar addiction. And that's a huge barrier for some of us to overcome. And we have to do that in order to achieve our health-related goals. But before we get into sugar addiction, I want you to kind of get to know who Dr. Unwin is. And I want her to give a little bit of a background in terms of, who she is and how she got into this whole sugar addiction space. So why don't you go ahead and introduce yourself, Doc?
Thanks so much. Thanks so much for having me, and hello, everybody. So as you heard, I'm a clinical psychologist. I've been working in the health service and helping people with chronic health conditions to sort of be the best they could. Alongside that, my whole life, since my earliest memories, I would say, looking back now, that I am a sugar addict. About 8 years ago, I discovered low carb, which was a massive help. And then, as Tony was saying, I started doing some work with my husband, Dr. David Unwin, helping people with type 2 diabetes to reverse that condition, but also people with other things such as obesity and fatty liver and so on. So over the last 8 years, just learned more and more about how to help people with that, but also, on my own health journey and trying to be the best I could physically. And it's probably about 4 or 5 years ago that I started to think more about sugar addiction as, what was it part of the puzzle as to why a proportion of us really struggle to do well on any diet, really, or to kind of stick with it. And certainly, although low carb is part of the answer, for us, it's not the whole answer. There's another whole piece of work that people with food sugar addiction issues have to embark on. So I retired last year from the NHS, and that's given me more time to start thinking about this issue, both in terms of what's the research saying, but also clinically, how might we help people with sugar addiction, and also obviously working on myself, which is important, working on my own recovery, which I'm really pleased with where I've got to at the minute with that. And I know not everybody's on the same journey, so it's important not to kind of think that what's worked for me will work for everybody else. But certainly learning as I go along.
Yeah, and I know a lot of people that we follow on Twitter and other places have, like Dr. Troy, for example. He had, it's TRO for those who don't know, but he's a phenomenal doc, and he lost a ton of weight and did really well. I mean, I can name all of these folk who struggled and they found their way to this dietary intervention. And that's why I'm happy we're talking a little bit about sugar addiction, because some people struggle and they need to know how to overcome it. I just wanted to do a shout out to Diana in California and Marie Jones in Colorado. And if anybody's live right now, and I don't know if anybody's in the UK that's listening, but tell us where you are, you know, what part of the country you're in. If you're in the United States or anywhere in the world, just let us know where you are, and we'll honor that and let people know. So I wanted
if you've got any questions.
Yes, please. Yeah, because you know what? We are here to help. This is passion for us. And I really want to make sure we're here to help you and guide you and hold your hand. So thank you, doctor, for that. And so let's answer the obvious, just the elephant in the room. So, you know, is there really a sugar addiction diagnosis? But I didn't see it when I looked at the DSM-5 book, which is the Diagnosis and Statistical Manual of Mental Disorders. That's made by the American Psychiatric Association. I didn't see it in there. So what's up with that?
What's going on? Okay, so
absolutely,
what's happening? You ask the man or woman on the street, is chocolate addictive, or are certain foods addictive, or can you get addicted to food? I think 90% of the general population are going to say, well, yes. We all have had struggles at times, or, we know people who are carry on eating things even when they know they're harming them, or when other people have said they're harming them, or, they try and stop and they just can't, or they say they're only going to eat a certain amount of something and they just blow right through that and carry on right out the side. So I think we all recognize that there are addictive type behaviors with food, but exactly as you say, the DSM, the Diagnostic Statistical Manual of Mental Disorders, doesn't recognize food under their substance use disorders. Neither does what we tend to use in Europe, which is the ICD, which is the International Classification of Diseases, published by the World Health Organization. Neither do they. And yet things like gambling are accepted. So people will say, oh, well, food isn't a drug, or it's not a kind of what's the addictive substance. But gambling is recognized can be an addiction, as a process addiction. So food addiction isn't even recognized yet as a process addiction. So obviously there are a number of people who are sort of campaigning for that to be recognized. And then there are a number of people who are quite vociferous on the other side, of course, saying, sugar in particular can't be and is not an addictive substance. So there's quite a lot of scientific literature on the question, and I'm hopefully embarking on a kind of review of all these papers that say it does exist or it doesn't exist, kind of trying to look at the balance of it. There's quite a few plausible mechanisms that have been discovered, sort of studied around food addiction and how it might be addictive. So sugar does actually have effects on the brain, on your kind of neurotransmitters in the brain, neurophysiology, and there's some quite hard data on that, and there's some animal studies which I know we shouldn't necessarily extrapolate over to humans, and as I say, there do seem to be a proportion of people who have these. So if you're looking for an addiction, it's cravings, it's withdrawal, it's using despite knowledge of harm, etc., etc. People who exhibit those behaviors towards food. And there's a measure called the Yale Food Addiction Scale, which you've probably come across. developed by Nicola Wiener, and there's quite a few studies using that with people, showing that, you know, there are a proportion of people who have those addictive behaviors towards food. So I think is it a useful concept? I mean, certainly personally, I found it incredibly useful when I started thinking that my history with food and my thinking and behaviors with food, if I started to look at it through an addiction lens, it kind of made sense to me, because I'm a sort of in all other walks of life could sort of organize myself and decide things and control things, and had no trouble with self-control at all, whereas around certain foods I would have that experience that I'm sure some people listening will recognize, where, for example, you'd say to yourself in the morning, right, I'm not having any of those biscuits out of that biscuit barrel, no more today. And then by about 3 o'clock, you know, when the time when willpower wanes, I'd actually kind of watch my hand like some disembodied robot going towards the biscuit barrel and eating the biscuits at the same time as my logical brain was saying, what, you know, what are you doing?
That's right.
And, you know, I really believe in all this stuff about, like, actually it is the primitive brain. It's the it's that sort of amygdala part of the brain, which is very primitive. It's not verbal. It's to do with dopamine and those and the kind of primitive survival mechanisms that's getting driven where sugar is concerned, and that you can't override that with the frontal logical human part of your brain is never going to win. That you have to win with sugar addiction you have to sort of act your way. You can't think your way out of it. You have to act your way out of it. Understand that it's an addiction, treat it like an addiction, and take the steps that you would if it was any other kind of addiction, like alcohol or drugs. So it's really helped me to think like that, and I've personally made a lot of progress. I struggle a lot less since I started looking at it like that. And I know, you know, other people, because now I'm sort of studying and kind of engaging with people around the world who are also looking at this. I know a lot of other people now who have found a lot of a lot easier way with food since they started thinking of it as an addiction.
Yeah, I have, it's helped my practice in that I didn't understand why people struggled. And so it's particular, like if I tell the average patient, just get your carbs under 50, and 70-80% of them, they do that and we're good and we're done. I mean, they may still struggle, but then you got this 20% or so who continue to struggle. And those are the people where it's very helpful to have an additional tool. So I'm happy that we're starting to dive into the space. I'm happy you're at a point in your life where you can give it more attention and help us all, hopefully. And I want to do a shout out to a couple of people. Got some folk from Maryland. So I love that. We got local, where I'm at in Chicago, got George Muhammad. He's kind of family too, a little bit. So shout out to him. We got Indiana representing the United States. That's Joanne Sawyer. So I want to do that as well. And we've already acknowledged, well, we didn't acknowledge Canada. So let's do a shout out to Virginia and Canada. So I just wanted to give them a little shout out for being live with us right now. I know it's a Sunday morning. You know, some of you guys we're doing virtual churches for those who are religious. So maybe it's not so hard to do it. So let's think a little bit about, it sounds like you're going to kind of either do research on the research, and you may do some research yourself. I had Dr. Joan Iflin on the show, and I've heard you share diagnostic criteria for sugar addiction. So she shared that. And I guess my question is, if you're a clinician right now, and you want to dive into this space a little bit, what do you recommend people do to start to harvest those people who struggle? Do we look at, and I'm sure Joan uses the criteria for alcohol and substances. the same? Is that the same set of questions you use as well?
Yeah.
And how is that different from the Yale? Is that the same as what the Yale people are doing?
Yeah, I mean, I think people could, if you're a clinician, you might use the Yale Food Addiction Scale, the YFAS, as a screen. I know that TRO does that.
Right.
So it's not a long screen.
Not a lot of questions. Okay.
Yeah. So if you start to think someone's struggling, or if they've really had lifelong problems with moderating sugar, particularly sugar and starchy carbohydrate intake, then that's a reasonable place to start.
Okay. And I think about our clinicians, and we're kind of evidence-based, and it's hard for us to do anything that's not like listed in a DSM-5 book. So I think that what I'm hearing from you and what I'm thinking is that until we get something more substantial, we're going to be kind of in the wild west until we get, because docs, they're not going to do it if it's not like a standard thing. So,
but I think you could, normally people are coming, they're likely to, there's a great big overlap with type 2. Quite a few type 1 diabetics have issues with food addiction. There's a big overlap with obesity, probably with alcoholic fatty liver disease. So those are the things I guess people would, in a sense, be coming for help with. And then you're finding them perhaps because they're struggling to adhere to the dietary recommendations. But I think then you can just signpost them and point them to, the various people who are working this space, the websites that are available. There's a new website coming from some sort of colleagues in the space, which we can put a link to if people want to sort of sign up for early warning, which is going to be a sort of recovery village. It's going to have all the information you might need and all the practitioners you might want to connect to. So there's things like that are useful. Obviously, Joe Niflin's
her reset community,
is available for people. And on the podcast we were talking about the importance of kind of groups and support, and that really comes into its own in this space, because sugar addicts tend to feel sort of isolated. I'm the only one I know here in the family. And so, you kind of feel a bit weird at times. But when you connect to other people and you've all got that same struggle, you're all on that same journey, that's so inspiring and kind of hopeful, because there's always people who are further ahead than you. So the social support is really, really important for recovery from any addiction. You need people traveling in the same shoes, I think.
That's right. I think that's it. And we have to support each other. I mentioned during the podcast, we have some groups for COPD and diabetes prevention. And what I found is that you become a little bit of a moderator. We just had a debate, and that was an interesting debate, by the way, with the president. It was crazy, but you have a moderator, and what we're doing is letting the people kind of support each other. And that's way more powerful than, because they may look at me and say, Doc, you've always been thin, so you don't know my struggle, right? They may look at me and they, so I think that it's nice to have people that they can kind of walk with. I'm curious, for the nerds who are listening in, could you talk a little bit about the mechanisms that lead to addiction, whether it's dopamine or hyperpalatability, things like that? Tryptophan, just speak a little bit about that so people understand why we consider this an addiction.
Okay, so there's a number of sort of plausible mechanisms, and probably they're all tied in together.
Probably all related. Yeah.
So a major one is the dopamine thing, and I like to think of it. If you think of it as from an evolutionary standpoint, I think this really helps as well, and I think it helps people who have a struggle with sugar addiction. So it completely makes sense from an evolutionary standpoint that if you came across some carbohydrates, some sweet fruits, some nuts in the autumn time, about now, it made sense that you were able to gorge on those things and put on fat. And you were very motivated to find that stuff in the autumn. So dopamine, which is the neurotransmitter of motivation and reward, you'd remember where that stuff was from previous years. You'd get down there early in the morning and eat as much as you could, and the brakes were off, and you get a big dopamine hit from anything sweet and sugary, and we all know that. So then you're motivated always to repeat the thing that gives you a big dopamine hit. So the next day or later on, your primitive brain, that amygdala part of the brain, is then going to drive you to go and find where that stuff is. Now, unfortunately, so back in the day, that would have taken effort. You'd have had to have walked there. You'd have had to have climbed up the tree to get the honey and get stung to death or whatever it was. So you'd really have to put some effort. These days, unfortunately, you literally probably have to walk to the cupboard. Or you're out in your car, you go and fill the car up with petrol, and there's chocolate all over the place, isn't it? I mean, you go to the supermarket, I mean, we're just absolutely drowning in sweet stuff. So our brains have kind of been hijacked. You're still getting that dopamine buzz, but we're just getting it so often. What the brain doesn't like is big imbalances in anything. Nature's very beautiful, isn't it? And it has lots of mechanisms for keeping everything in balance. So what the brain does if we're getting these big dopamine hits is it down regulates it kind of numbs off the receptors so that you get less of a hit if you keep repeating that. But the motivation is to get the hit. So what happens, you don't just have one slice of cake and get your dopamine hit. You kind of think, oh, I'll just have another slice to get that same kind of feel good feeling that, for those that are heading into a sort of sugar addiction problem, if you're eating kind of with some sort of emotional kind of overlay, or as a kind of stress reliever after work or whatever, you're going to have more and more. And that's a characteristic of addictive substances, nicotine, alcohol, caffeine. You always have to have more and more. Tolerance is one of the descriptors, isn't it? You have to have more and more to get the same effect. So the whole dopamine system is one whole system. The other whole system around serotonin. So serotonin is the kind of relaxed, nice feeling. And that's why a lot of people eat chocolate and sugary, starchy foods, is to get that kind of relaxed, nice feeling from serotonin. What happens when we eat a lot of sugar is our insulin levels go up. I'm sure you've talked about that a lot. In the presence of insulin, the precursor to serotonin is tryptophan, which you mentioned. In the presence of insulin, tryptophan can cross the blood-brain barrier much more easily. It normally competes with a lot of other amino acids. And in the presence of high insulin, tryptophan can get into the brain and be converted easily into serotonin. But again, there's that similar kind of thing going on, whereas the more you do that process, you're obviously depleting tryptophan. Your kind of your receptors are trying to balance up, the serotonin, and you need more and more to get the same.
So you'll end up. So it sounds like if tryptophan leads to serotonin, initially it's going to increase your serotonin, but then you're saying it becomes depleted. And so you're running out of serotonin. You also said, that it's, and we know this is what I'm learning in school. So this is one of those essential amino acids. And you're saying that it competes with other amino acids. Now, don't want to get off the path too much, but it seems like if I eat protein, I'm going to get, and other things that have tryptophan, and it seems like that would be helpful. But if I eat too much sugar, that could be harmful over time. Is that basically how we should think about this?
I think so, yeah. I'm not sure of the evidence of dietary tryptophan, and I it's not my specialist area, but these are the headlines that I understand.
Right. Yeah. Okay, cool.
And so what I was thinking when you were speaking then, something interesting. Yeah. So you a lot of people with sugar addiction problems, or people who eat a very carb heavy diet, we know that they tend to have low mood and depression, actually, and it becomes a horrible vicious cycle where you feel you feel bad, you eat stuff trying to make yourself feel better, but actually
up and down roller coaster.
Over time you're depleting, you know, you're not helping your brain at all. And I think it really helps people to understand this information, because then they can, you know, you can take action. You know, you want to look after the brain's really important. You know, we need to look after it. So, and then you mentioned hyperpalatability, so that we know that a lot of these processed foods are actually literally designed in the lab to be irresistible. I think do you have Doritos and stuff like that? We have that stuff like that.
You can't stop. I mean, once you, like Pringles, I mean,
you
isn't it Pringles?
No, super hyperpalatable.
Yeah.
Sorry, say again.
Yeah, I was just thinking about Pringles.
Oh yeah, Pringles. Yeah, you can't just eat one. It's absolutely
right. I remember that commercial. It's like you can't stop, right?
You look at the ingredients on the back and you just think, holy schmoly.
You don't want to know.
This is a chemical. Yeah. So it's hyperpalatability. There's also there's a kind of negative reinforcement process as well. So we know that if you kind of have a high-ish carb diet, obviously when you talked about the roller coaster. So we know that when you eat a lot of sugar, you get insulin released, and that's to drive down the sugar, because the body doesn't want you to have high blood sugar, drives it down, usually overshoots. So you get a kind of, you know, we've all had that, where you get a bit kind of, you know, you're hungry, you're a bit shaky, you're a bit sweaty, you've got a bit hypo. And if we eat something sweet, obviously it relieves those negative symptoms. So that's very reinforcing. And we tend to repeat behaviors that are reinforcing. So we tend to repeat a behavior that is going to relieve a negative feeling. And people even say things, don't they, like sugar fix, or, you know, we actually use the language of drug addiction where food's concerned. Yeah. So there's a few different kind of.
Okay. Those are very helpful, those mechanisms. I just want people to understand why we think that sugar addiction is a thing. Is because we see that correlation between our patients, and I wanted to, maybe you can answer the question. I'm hoping to have Dr. David Unwin, Dr. Jen's husband, on as well as early as the next episode, but we're gonna probably ask him to bring some of his charts to the conversation. So when we are live, we can maybe show those. But I guess the question is from Gwen, where can we find his of sugar charts?
Gwen, what you need to do is to go, I'm just going to double check the website so I say it right. It's www.phcuk, I'm just checking. www.phcuk.org.
Cool. Okay. So
PHC is the public health collaboration in the UK, and they host all the sugar charts, and they're in 11 languages now, which is absolutely brilliant. Loads of people have been translating them for him. And they're obviously free to download and free to use in any way that you find helpful.
It's just nice that he makes it simple and easy. And as Marie has said, you know, it's that support. You know, we're supporting each other, and we support each other also by making things easy to understand. And so rather it's in a group setting or a great chart, or maybe your ability to listen to people with hope and grin, you know, which they'll learn about when they do the podcast, and how we use those things to help us understand. And I just wanted to share that. I just think that's awesome. Also, a shout out to Springfield, Illinois. Thank you for Lori Hamill for sharing her thoughts, and we're going to do our best to keep, you know, educating people every step of the way. So one question that is interesting is that around how docs and nutrition professionals and pharmacists, how they believe that balance is the right approach to nutrition. So, you know, I've learned that maybe it's not about balance, it's about avoiding things that cause harm. I don't want to have a balance with my slice of cake and other things. So what's your thoughts on moderation and balance as an approach to nutrition versus maybe targeting certain macronutrients or avoiding certain macronutrients?
Mm-hmm. The word moderation, it's such a thing, isn't it? And kind of what does it even mean?
Right.
So I think I wish no one would ever talk about moderation. I think it's about what is a person's goals and what are their health what are they aiming for, and what are their health metrics?
Right.
And some people can tolerate a bit more healthy carbohydrate, can't they, than others. Where in the context of sugar addiction, moderation is as pointless as saying so someone really is a proper lifelong sugar addict. You would never say to an alcoholic, have whiskey in moderation, because they can't. Right. They've lost control of that relationship. As you'll have heard of Robert Sivis puts this so well, doesn't he? You've lost control in that relationship, so you can't moderate it. So that's the problem. It's a bit like, for some people it's really hard to understand why people who have a problem with alcohol can't just stop or can't just have one. They really struggle to understand that. And I think it's the same that people sometimes struggle, that those of us with a proper addictive relationship to sugar can't just have a little bit. Right. And that's one of the challenges in recovery, is dealing with those social situations which you will encounter. We all encounter.
And holidays are coming up. You guys have some. I mean, I know you have Christmas. You guys probably don't have Thanksgiving in the UK.
We don't have Thanksgiving, but we have Halloween.
Yeah, that's coming up. Oh my God. And
absolutely. And just about every festival now is a festival of sugar. I mean, it didn't used to be like that. Easter, Christmas, birthdays, Halloween, you name it, there's some sort of confectionery cake kind of thing going on. So you have to be able to sort of negotiate that, and it takes some years to do that. And there's also, in the workplace, there's always a cupcake maker. There's always one who makes the most adorable cupcakes when it's someone's birthday, and you don't want to offend them, and you have to find a way to negotiate that kind of social challenge around sugar, because it's so ubiquitous. And this whole stuff about the way that we we kind of reward children, we praise children, we kind of show children it's a treat with sugar. I mean, that's it's kind of how I was brought up. We're trying to break the mold. My daughter's been absolutely brilliant with her grandchildren and with the grandchildren, and they really never expect anything like that, and they don't feel they're missing out. But it has taken a long time for us to kind of get to that point.
And what's funny, for those, as we work to help people achieve, we call it metabolic health. Mm-hmm. There's a point when you get metabolically healthy where you can have your cheats. I mean, it's not that you should never, ever. Now, the catch to that is if you have an addiction, that may be a problem.
It's different advice, I would say. Yeah, totally. I think there are some people who can flex it a bit, can totally just get back on track the next day.
That's right.
Where there's an addiction problem, usually if we go off the rails, we might go off for a few months before we manage to rein it back in. That's right,
and we wouldn't want that. Now, this is a question that you were kind of answering, but can you kind of comment a little bit more about, I know we talked about hope and Gran in the podcast, but is there a way to answer this question from, I think it's Kenya, about, how do we overcome it? I mean, obviously we got to work on the mind, but is anything you can say real quick about that?
It's a really great question. And I think it does take time, effort, and community and knowledge, the sort of things we've been talking about. And a great way to go is to start. I mean, so obviously the nutrition is an important part of it. If you're a smoker, you can stop smoking, and if you're an alcoholic, you can stop drinking. I mean, that's easy peasy. We can't stop eating, can we? But it's what do we eat? Right. And low carb and keto is a great place to start, because the foods that have that addictive effect on the brain are sugar, starchy carbohydrates, and those things in combination with fat and salt. So things like, we're triggering everybody now by saying things like donuts, cakes, French fries, all of that. So all of those things are the thing that, what can you not moderate? And start low carb and start like that. Then there may be some other things that down the line you still can't moderate. So personally, I had to give up. I can't have nut butters, for example. I just cannot moderate my relationship with peanut butter. It's gone. It had to go.
Same problem.
It's just, life is more peaceful without a jar of peanut butter in the cupboard, let me tell you. So that's gone. And, you know, various other things.
So you make your house a safe, it sounds like you make your house a safe space.
Oh, the house should be the your immediate environment. If it's there, you're going to want it. Don't buy it. Don't bring it in the house. It's difficult, I know, in families, if not everybody's doing this together. But can you have your own cupboard? Only go in your own cupboard or your shelf in the fridge. The environment is really important. You know, get the food down. Get some support. But then, you know, expect to slip up. But then learn from those slips. You know, say the peanut butter slips. Oh, it had to go. Also, sweeteners, in the end, they weren't my friend. They're not the friend of the addict because they keep that sweet tooth going. They had to go in the end. You know, you learn how to handle these situations where you may be in danger of kind of eating sugar and so on. And then try the other, really, you know, at least half the work is then trying to replace the serotonin and dopamine and the good stuff in your life, you know, not using food, because food is kind of crowded out usually all our coping mechanisms. We've become focused so on food for comfort that we've forgotten about everything else. And there are loads of other things that you can do to get serotonin and dopamine in your life in a healthy way, and try and building those things up. So things like exercise, so important, as you say, stress management.
You get a rush. I mean,
you get a total.
Once you get past the first few weeks of struggle, but once you get,
we recommend.
I really never look forward to exercise, but I always look forward to what I feel like afterwards. Always.
Yeah, exactly. Make it a habit. And we talk about just start with walking. Walking's good enough. You know, if you can walk, if you're able to do that, gentle walking, get outside in the daylight, you're going to get serotonin. Yoga's fantastic actually for serotonin. Dopamine's to do with rewards. So anything that gives you a bit of a sense of progress. I mean, that may be exercising and trying to do a little bit more, or people will be able to see. I'm a mad knitting fanatic.
I see that.
It's my wool on the wall. So, you know, that's nice because you make progress, you make things for people, you're occupying your hands. There's lots of evidence for that's very good for the brain, this kind of knitting, crochet kind of stuff. Singing, there's loads of ways to get the feel good stuff. Gardening.
What about because you're a grandparent, I know you're going to be hanging out with the kids later. So what does that do for you?
Oh yeah, I mean, you know, that's just so grounding, isn't it? And they're so, you know, you get oxytocin because you get lots of hugs from grandchildren. Even in the COVID times, you can have hugs, you can have hugs from grandchildren. You know, so you get in the closeness hormone, the oxytocin. It's really important that all of that stuff is part of recovery. For the lady that asked the question, it's not just about food. If it's just about food, those are the people that can do it. You know, you like you say, the 70%, 80% of people who, it's difficult in the beginning, but they get in the swing and they totally get it, and they can have the odd cheat day. That's all fine.
Right.
The proper hardcore sugar addicts, we need to work at just the whole kind of life, the life stuff, as well as the food's important, but the rest is important too.
Yeah, and even more importantly, if we're healthy, we'll have more time to be here for hugs, and and that wisdom. Some of what you mentioned on the podcast is just being here as you try to define, you know, what is your why moving forward, and some of it's just to be here to educate those babies about their destiny. And I'm curious, as I think about family and genetics, a lot of people, I'll see patients and like the entire family is struggling with sugar addiction or weight issues or diabetes. And so I'm curious, from your experience, is it a more of a genetic predisposition, or is it the habits of the family that seem to be the thing that kind of drives, these addictions? What's your thoughts on?
I think both are important. I think there's definitely a genetic factor. So looking back, my mother was definitely a sugar addict, 100%.
Right.
She dieted all her life, but also you learn that stuff, don't you? Because you grow up and you're sort of fed in that environment, and you see those sorts of behaviors. So I think it's both, but there does seem to be a genetic component, partly because we know that sugar addiction will also go along with other addictions. So there's many outlets to addictive behaviors, and that we know, for example, that people that give up smoking will tend to put on weight. That's because they start eating sweets and other things. And people with alcohol trouble, when they give up alcohol, they might increase their smoking or caffeine use, or again they may turn to sort of sweet food. So there seems to be a tendency for that sort of addictive type brain in families. And when I'm doing assessments and I ask about family histories, there's nearly always someone who's had an alcohol problem, as a close relative, or other food addicted people in the family. So I think it's both.
Okay.
Trying to, obviously we can't change our genetics, can we? But we can definitely change the thinking and the culture, and we can try and kind of counter it that way.
You touched on groups in the podcast. We talked about the value of having and it sounds like in this setting, when you have people who are struggling, we have some virtual things that we can offer them, the work you're trying to do, and Joan Iflin, Dr. Iflin, her work. And it sounds like being able to utilize that type of model is critical. So for those who are listening, your thoughts on, is there, I know Joan Iflin has her reset community. Could you just give us an idea of what's out there when people are struggling? Because their doc may not know a lot about this, because it's not an official diagnosis. So what do people do to get help and support?
Joan Iflin's addiction reset community is out there. There's, as I say, there's a new website coming, which is called Sugar X Global, I think, but we can put I know that the link is going live, so people can sign up for that soon.
Okay.
Some colleagues that I'm working with. There's a great Facebook page. There's a few Facebook pages, but one that I particularly recommend is, because I'm working with Bitten Johnson in Sweden, who's been doing this work for years. She's got a Facebook page called Sugar Bomb in Your Brain. Sugar Bomb, all one word, in your brain. A great quality advice there, and some resources up in the files boxes on the Facebook page there. And some of the people who are involved in this Sugar RX website are on there as well, so you can connect with them. There's a free meeting on a Thursday night run by David Wolf, who's a dietitian who specializes in sugar addiction. That's via Zoom. So there's not loads, but there is support out there for people. And it is a very, very important part of recovery, is finding your community and sticking with them, and just ask if you're struggling.
Yeah. And I see that Marie Jones kind of made a statement that's very true. It's
absolutely.
So you have to, so in your brain, people who are dealing with substances, whether it's alcohol or, crack or cocaine or anything like that, people always tell them this is a lifelong struggle, right? So when it comes to sugar addiction, do you think for people who really meet the criteria for that, do you think that it's pretty much going to be a lifelong battle?
Yeah.
Is that a fair statement?
Yes. And that when you relapse, you tend to it's like any addiction, you tend to relapse worse. So it's kind of important to learn not to, eventually try and learn not to relapse, because it's not something that is getting better in the background. You get better at dealing with it, and you get better at living without that substance. and you can, live a fantastic quality of life. But it's trundling on in the background.
And do you think that, so as we work to change perception, one of the things I've had to learn in my training is not to blame the victim in a way, right?
So, 100%.
So what do you think sounds like you're going to be doing some research and helping to create support for patients, but as it relates to our clinicians and trying to change the perception that they have about this, is there anything, do you think it's mainly getting it as an official diagnosis, or are there other things we need to do to get this whole medical community to change and to see things through a different lens?
I think if we could get sugar food addiction recognized even as a process addiction in DSM, I think that would be massive, because then what you get is funding for treatment, funding for research, etc. So that would be huge, and there are people campaigning for that. So Joe Nifland, amongst other people, I'm sure, involved in those sorts of discussions. So let's hope for that. I think in the meantime, I think it's important for people to tell their stories, to kind of band together. We can carry on trying to do some research. I think we can try and help people in their recovery. And it's a bit like low carb in a way that it sort of spreads a bit like a virus, doesn't it? That once one person, often spreads their knowledge to another person, or all the clinicians that are working in low carb now are helping people, but they're helping their families and they're helping other people as the knowledge sort of spreads. And I think that's a sort of similar thing, really. If each of us with this problem can kind of work on our own issues, and then reach out and help somebody else, that's one less person who's bewildered by why they behave the way they do, and
okay.
Can
I was, I'm sitting here thinking, right, and I'm thinking, okay, what would be helpful? I think, even if I'm a patient right now and you're my therapist, right? If I walk into your office right now and I'm not, let's just say I have a test and it shows I'm borderline diabetic, but I'm not an obese guy. I just don't want to be diabetic, right?
Mm-hmm.
Could you, maybe we can role play just a little bit. I know I've seen you do that before, but maybe you could I'm going to walk in your office as a patient, and maybe we can kind of make this our final kind of few thoughts. How would you interact with me so that I could walk out of that office with hope and the idea? So is that something you'd like to play along?
Yeah, absolutely. I would.
Yeah, so let's try that. So I'm sitting on the exam table, and let's start our conversation, just so people can understand how we can do things a little differently. So tell me how you would approach that.
Tony, I'm so pleased you've come in today. What are your best hopes for us meeting today?
Well, I talked to my previous doc. I had heard that you approach things a little differently, and I was a little worried because when I got my labs back, everything seemed okay, but my hemoglobin A1C, my diabetes test was around 6.3, and the doctor at the time said that he wanted to put me on metformin, a medicine. I was like, well, do I have diabetes? And now you're borderline, but you should take this medicine. I don't really want to take medicine. And, but I also don't want to be diabetic. And I just don't know what to do. All these people in my family have diabetes. I have an aunt who had an amputation. I had another uncle who's had kidney failure, and I just don't want to be that person.
Wow.
So
so
that's all.
Yeah. So if we work together, and in 6 months' time, everything had gone amazingly, what would be going on, or what would be different in your life?
Well, first of all, my number, I'm not sure what normal is, but I'd want my diabetes not to be borderline. I'd want it to be normal.
Mm-hmm.
And I do tend to be a little tired at times. So I would want to have more energy. And although my kids are older now, they will have grandkids one day, and I want to be able to have the energy to play with them. And because I'm tired, in my profession, I want to have mental clarity. So I want to be able to think a little sharper so that when I'm interacting with people, I will feel, more alert and more sharp.
Yeah, that's an amazing answer. So you'd like your blood results to be normal, and you're hoping that along for the ride will come more energy and feeling sharper, and that would have all kinds of benefits for you in family life and
That
work
would be
life and stuff.
huge. I'm too
That's
young to be
amazing.
tired. I
Yeah.
I'm 52, and I heard that was the new 32. So, but I
So,
don't feel like it.
okay, so if in 6 months' time you walked in, you were telling me you had more energy and you felt sharper, and we had your normal blood test on the desk, let's call that 10 out of 10. We've
Okay.
really made it. We've really made it. If that all happens, if 0 out of 10 is as far from that as you can imagine. So you kind of, you're tired a lot of the time. You're not feeling sharp. This blood sugars might be affecting your mood. Where would you say you are today out of 10?
I'd say probably about 5. I'd say I'm
Okay.
about a 5. So I'm not doing too bad. I'm functioning
that's good.
okay, but it's not. I know I should be better. I think back when I was younger and I was way more energetic.
Yeah. So 5 out of 10. So tell me what makes it 5 then. What's already going well for you? What's already working? When do you have a good day? That kind of thing. Tell me about that.
Well, the coffee helps, but besides that, if I get enough sleep, right, I tend to do much better. I don't exercise consistently, but when I do exercise, I tend to feel better.
Yeah.
When I am more organized and I can go to work and I've kind of prepped, like today is a Sunday, so if I kind of get ready for Monday, I'll do better. So those are so if I can start my day and keep the stress down, because stress is the thing. When you're a professional, stress is what makes it hard. So if I can get those things to do better, that would lift that number up.
Okay, so you're already at 5 because sometimes you're getting good sleep and that helps. Sometimes you're getting good exercise, that helps. When you can be organized and prepared and keep the stress under control, that's helping as well. So that's amazing, that you're doing all that already. That's really, really good. And if maybe next time we met you were 6 out of 10, what would that look like? What would you be doing differently? What would you be noticing you'd walk in my office and you'd say, Dr. Jen, I'm a 6 because?
I probably would have done some things to probably make my I'd probably be eating a little different. So, instead of stopping by, Dunkin' Donuts and getting coffee and a donut, I'd probably maybe get coffee without sugar in it and something, because the other doctor told me sugar was going to raise my increase my risk. So I would probably stop doing that. And because I do notice when I eat donuts, sometimes an hour or so later, I want another donut. I would change how I eat.
That's how they get you.
Yeah, it tastes good going down. Let me say that first of all. But then I'd definitely be a little bit more consistent with exercise. So instead of doing it periodically, I'd probably get on some type of 3 days a week or something program. And then I try to be consistent with sleep. I try to go to bed at a consistent time, and as opposed to trying to, like the NBA playoffs are going on. So I'm not going to stay up late to figure out if LeBron or my favorite player, Jimmy Butler, if he won. So I'd be just going to sleep, get the highlights the next day. So, but that's hard to do. And I'd have to teach myself how to do that.
Okay. So if next time we met, you'd been able to just have coffees without the donuts, and you notice yourself exercising 3 days a week and, being a lot more consistent around your sleep. Yeah.
I think I could. Yeah. I mean, I think that's something I would like to do. I hope I can stay motivated, but that would make a difference, I think.
Yeah, I'll be really interested to hear about that when we next meet. And also I'd be really interested to hear about what you notice the effect of doing that has on your energy and your sharpness, which is what you're hoping to notice improving.
Yes, that would be awesome. So I love that. And you're the first doctor who asks questions like that. Most of them just, like, with all due respect to my previous doc, he didn't talk about this. He just talked about metformin, and I'm sure it's a great drug, and I've heard that it really does help, but man, it just seems like almost like a cop out. It seems like there's more I can do. So I appreciate you talking me through some of those things I could change.
Yeah. You seem like a motivated, organized person to me. And,
on some days.
I really believe, you can do this.
Absolutely.
So I'll see you in 2 weeks.
Absolutely. Looking forward to that. So that's helpful. So so it sounds like that's how you walk through a visit. And is that what your husband does as well?
Yep. Yeah.
Okay.
So he does it in his 10-minute appointments. And of course, he'll weave in some, here's some information cards, you're right about the donuts, completely. You're trying to bring the sugar right down, and the cards show you where the hidden sugars are. That people know you shouldn't have donuts and sugar in your tea. What they don't know is that you shouldn't have cornflakes and porridge and pasta.
It seems so innocent. I mean,
brown bread, they will say, "Oh, I can have brown bread, right?" No,
right. That's right. Yeah,
not if you want to reverse your diabetes.
Right. Even brown rice, it does have more fiber, but man, the carb number is very similar. So we have to. A lot of my patients have been doing cauliflower or tater tots lately because you can get it in the frozen section. So little things like that, and I see Gwen mentioned that, Overeaters Anonymous 12-step program. So I appreciate you sharing that. And so I wanted to, the reason why I wanted to do that I had seen you do something like that before. So I wanted to get a little bit of that experience of how you guys walk through the visit. I think if anybody is a clinician listening, we have to ask these questions because it's return on investment. So if you get to the root cause of why people struggle, your return on investment is going to be much higher. So we want to encourage patients and clinicians to ask those types of questions. So I really appreciate it. And I think that, as we kind of, get to wrapping up, I think it's important that everybody listening understand that there is a path to healing, but that path just requires some new knowledge. And then taking these tools that we have, these resources that'll help you walk towards your goal. And that's why I want to bring thought leaders like Dr. Jen Unwin. Her husband will be joining me soon as well. And we'll talk about the work he's doing. And I just want you to know there's hope. We do not have to be sick. We do not have to be chronically ill. And we'll make incremental changes to walk towards health. So as we kind of wrap up, Dr. Jen, what do you have any final thoughts you'd like to share that may inspire people, or life lessons that you'd like to share with those?
I just agree with your sentiments so much. I think it's really important that people never give up hope with themselves, even if they haven't yet found the solution. Please don't give up hope. There'll be someone out there who's walk the same struggle as you, who will be a few steps ahead of you, and you can use for inspiration. And also for those of us who've found some solutions, I hope that we'll all just continue to share that knowledge. And I know not everybody finds exactly the same solution. There's different solutions for everybody, but that it's out there. Please keep trying.
That's right. And I mentioned on the podcast that you have a beautiful Twitter photo of a nice country scene, and it made me feel like relaxed just watching it. So let's remind people where they can find you on Twitter. And I do want to say this to people who are not as engaged with Twitter. It's a different kind of animal than Facebook, clearly. But even if you just get an account just so you can follow people who you are going to learn from, it's probably worth it. So I encourage you, rather it's my, Dr. Tony Hampton on Twitter, that's a DR, or what's your Twitter handle, Doc?
Yeah, it's at Jen _Unwin.
There you go. So please check her out. I'll be there as well. And sometimes we fuss at folk, and sometimes we, so it's actually fun just to see how the conversations go, because we have to kind of justify our beliefs. So having said that, I want to thank you for spending time. I know you're going to get to the grandkids and do that work, which is the most important work. And I hope everybody listening was learned something, walked away with something that will help you on your journey, and we'll continue. I'll keep doing the podcast every week. Again, the episode that we just recorded will be out on the 9th, and you'll learn a little bit about hope and the GRIN acronym and what that's all about. And that'll be it. So everybody have a phenomenal Sunday. And thank you for being engaged in the chat area for those who did. If I see any questions that come up later, we'll get those to Dr. Jen as well. So take care. Have a wonderful evening. And thank you, Doctor, for being here today.
Thanks, everybody.
Absolutely. Bye-bye.